The following slide presentation has been designed to help you identify the different characteristics of various implants in the OsteoTie system. Please note that this is for information only, and any errors or liabilities which may occur as a result of either misrepresentation or lack of understanding rest entirely with the surgeon restoring the implant. OsteoTie cannot be responsible for any damage that may occur to either equipments or injury to patients that may result as a subsequent of the improper use of its equipment or prosthetic abutments. Also be aware that our reception staff are there to help support our users who are fully trained and aware of the features of the system. They are not dentists and they are not technicians, and they are not able to give any technical support or treatment planning representations. If you wish to speak to a dentist or have a dentist or technician review your radiographs or case, this can be done for an additional fee of £50 payable prior to the consultation. We are happy to look at radiographs submitted. However, in the first instance, please look at this presentation, and if all is not clear at the end of that and you require further support, then we are able to provide that, but at additional fee. If you are a system user, then the service is free of charge. Now, over the 30-year lifespan of this system, obviously there have been several series changes, updates and modifications. The first series, which was introduced at around 1990, and then this was followed by the Series 2, which was introduced around about 1998 to 1999, and then this was followed by the Easy Plant in early 2000. The Series 1 and Series 2 and Easy Plant all accept the same restorations, all accept the same abutments, all work with the same transfer components. So if you have any of the earlier series, these are series probably dating back before 2005, then they all work with standard abutments and transfer techniques for the Series 1, 2 and Easy Plant. If however you have an anchor lock implant which was introduced probably mid 2005, then these are slightly different, and although the hex diameters are the same and the actual tools required to fit the abutments and the post screws are exactly the same, the abutment interface is different and they are not interchangeable. Also, we do not recommend the use of the OsteoTie system with any other manufacturer's components or instrumentation. Should you do this, then all product liability is waived, and you do so at your own risk. Before moving on further, it's worthwhile just explaining some of the terminology that will be used during this presentation. The implant platform basically is the most coronal section of the implant to which the abutment is fitted. When the abutment is placed on top of the implant, we then have the implant abutment interface, which is the space or the connection between the implant body and the abutment. Now, in an ideal world, the patient should have the batch number and definite identification of the implant type and series, or even the implant manufacturer. This often does not happen, so we are reliant on radiographs. Radiograph features are almost 80% correct, however they can be misleading and difficult to read. This is an example of a Series 1 implant, and the main features to look at here is that the implant body is parallel and not tapered. Also, the abutment fits flush. At the implant abutment interface, the abutment fits flush. There is no spacing or gap between the two. So these features almost certainly mean this is an earlier type of implant and would be a Series 2 type of connection. So this is our standard early implant design, and the office will be able to help you with the components for this, and you will see that there is a presentation about how to go about taking a transfer impression related to this type of interface. So this is our standard early interface. This is our EasyPlant design, and again the interface is the same for the EasyPlant. The implant abutment interface is the same for Series 1, Series 2 and EasyPlant. So they work with the same restorative components and instrumentation. The thing about the EasyPlant is the side of the implant is not parallel anymore, but is actually tapered. But again, if you see an implant with an aggressive taper like this, it is most likely to be one of the earlier implants and not the anchor lock system. In around 1996 to 1998, the system introduced platform switching. If you're not aware of platform switching, this is where the abutment has a slightly narrower diameter than the implant head itself. So if you see this kind of arrangement on a X-ray, then this is showing platform switching, and most likely we're looking at an earlier design of implant abutment interface. This radiograph shows two types of abutment interface. As we've said, the actual sizes and the prosthetics are the same for both. However, we have two varying examples. The implant on the right hand side of your screen has got definite difference in diameter between our abutment and our implant diameter. So there's a difference there, the abutment being slightly narrower. So this is definitely platform switched, and also this will be a Series 2 implant. There is no gap. The abutment fits flush with the implant platform. Here, this again is a bit more difficult to read. It is again platform switched because the interface or the connecting part of our abutment to our implant is inside the diameter of the implant. So again, this is an example of a platform switched implant, and this would be a Series 2 implant. It's tapered, and there again is no gap at the implant abutment interface. There is no gap or spacing that can be discerned from the radiograph. Obviously, much of this depends on the angle at which the tube is positioned, and sometimes this can sometimes make an anchor lock look like a Series 2 because of angulation and superimposition of the two images of the abutment against the implant body. However, this would be quite obviously a Series 2 type of connection, being as there is no space between the two. These are again examples of Series 2 type connections. There is no space between the abutment and the implant. The implant abutment interface is quite easily discernible. There's no space existing here. The abutment fits quite flushly on top of the implant, and also this particular implant is platform switched. These two implants are not platform switched, and in fact the abutment is slightly larger than the fixture itself. Again, this is an indication of a Series 2 type of connection. On the anchor lock range, the abutment would never be larger than the implant diameter. It will either be equal or slightly smaller, but never larger. So if our abutment looks larger than the implant diameter, then this most likely will be either early Series 1, Series 2 or EasyPlant. In the anchor lock range, the abutment diameter will either be equal or smaller to that of the implant diameter. except in situations where the implant is a 3.2 millimeters, in which case the abutment will appear slightly bigger, but there will be a noticeable gap at the implant abutment interface or spacing. The abutment will not appear to fit flush at the implant abutment interface. Again, we have a Series 2 type of connection. There is platform switching occurring here, in that the abutment is slightly smaller than the diameter of the implant. The abutment is fitting flush at the implant abutment interface. There is no space, and there's a definite little taper lead in like that. This is indicative of a Series 2 type connection, and this would be an easy plant because the body is again tapered. Again, this is an example of a Series 2 type of interface. Again, we can say that this is a easy plant because the implant is tapered. The abutment in this situation is very slightly larger than the diameter of the implant. This is because this implant is a 3.25 diameter implant, and the abutment is most likely 3.75, so the abutment will overhang the implant. Now this type of appearance will be seen on the anchor lock as well, but the main thing to notice is this lead-in. There's a 45-degree taper lead-in. This is only seen on the Series 1, Series 2 and Easy plants. You will not see this on the anchor lock. So this is what tells us that this particular implant is a Series 2 type of interface. Another example again of easy plants, tapered implants, quite aggressive thread form, and the abutments in this case are slightly larger than the 3.75 diameter implant, again indicative of a Series 2. And again, look at this taper leading into the implant and short hex. These are all features of the Series 2 connection. Again, a feature which is indicative of a Series 2 or an earlier design is that the implant now is completely flush with our abutment, and there is absolutely no gap or anything between at the implant interface. So this is a Series 2 or easy plant type connection. The abutment is the same diameter as our implant, but there's no platform switching and no space between the two. So absence of platform switching will mean that the implant is an older version, and of course this implant is parallel sided, meaning it's more likely to be a Series 1 implant. This again shows two tapered implants, immediately indicating that this is an easy design. Again, this particular implant is not platform switched, so definitely not an anchor lock because it would be platform switched. This implant is platform switched, but again there's very little spacing between the two, and you can just make out perhaps a 45-degree taper on here. But this again is a Series 2 type of connection. Now let's take a moment to acquaint ourselves with the design features of our anchor lock implant. The main feature of the anchor lock implant is that the abutment locks to the implant so that a hermetic biological seal is formed, which reduces micro leakage at the implant abutment interface and reduces the amount of loosening of our abutments. So on this type of abutment we have a very long lead in, and then we come to the actual hex at the bottom. This area here has been designed to produce this hermetic seal to prevent micro leakage, which normally occurs from the occlusal cavity out this way in systems that don't have this feature. But the other interesting thing to note on this design is that the abutment does not fit flush on the implant abutment interface. So if we look carefully, we can see that this does not fit down flush on that implant abutment interface. There is this small gap between the two, this area here. Now this is quite easy to spot diagrammatically, but isn't so easy to spot sometimes radiographically. But what you will see again is there is no definite taper leading in. This implant has no taper leading in because the abutment fits inside like this into our implant, so there's no 45-degree taper that we would normally associate with one of the early series. And also the hex extends far deeper into the implant than on the earlier series. In the earlier series, the hex would be at this level and there'd be a 45-degree taper in, like so, whereas on the newer series we first of all have platform switching as standard, and we have this small gap, and there is a lead in, and then the hex is positioned far deeper into the implant body than on the earlier systems. So these are the design features. You have to look very carefully at the implant to decide what you're actually looking at. So to sum up this presentation, we're going to try and look at the radiographic features between an EasyPlant Series 2 type of connection and an anchor lock type of connection. First of all, radiographically, the implants can look very similar. They're both tapered in appearance. However, on the Easy type of design, the threads are much further apart than on the anchor lock design. The thread pitch is completely different. So that's one giveaway by just looking at the implants and the thread pitch. So the next thing to look at is the detail of the implant abutment interface. Now if we look at the Series 2, this is a platform switched type of arrangement. However, there is no gap at the implant abutment interface. The abutment sits flushly on the implant platform. So at this level here, the abutment sits flushly, and also there'd be a 45-degree taper from that abutment going in, and then we'd have our hex positioned like so, our implant hex here. So this is how this type of abutment, and this would be a Series 2 type of connection. Now let's look at the anchor lock type of connection. If you look carefully, you'll see that the base of the abutment is there and our implant platform is there, and there's a small vertical space between the two, which is a design feature to aid platform switching and our hermetic biological seal. Also, there is no 45-degree taper. You will not see a 45-degree taper and a hex on this system high up. What you will make out is perhaps a long lead in, and the hex is positioned far more deeply and runs out in that level there. Again, not easy to spot, but if you look at where the abutment screw starts to appear clearly, it's in this area here, whereas the abutment screw is tending to appear just perhaps a little higher up. But again, it's not easy to differentiate the two, apart from perhaps looking at the implant body itself and looking at the thread pitch, which tends to be wider, and looking very carefully at this implant abutment interface, which, as I say again, is flush. So the abutment actually fits flushly onto the implant platform. On this situation here, the abutment is actually separated and sits above the implant platform, and you can almost make out in that area a very small space. I hope this presentation has helped explain some of the design features between the different implant varieties which OsteoTie has manufactured over the years.